I'm doing my capstone project for Nursing 475 on congestive heart failure and how that affects those with dementia. The objectives of this project are to define congestive heart failure, identify individual and families affected by new diagnosis of CHF and early dementia, understand health literacy issues for congestive heart failure, identify community resources available for individual and families, support findings through interviews and scholarly articles, support resources and findings through an interview with a home healthcare nurse, present Healthy People 2020 goals of CHF and dementia, identify social, political, and ethical issues related to this population, and finally establish population vulnerability and how nurses can support the population. What is congestive heart failure? According to the American Heart Association, congestive heart failure is a chronic progressive condition in which the heart muscle is unable to pump enough blood through the body to meet the body's needs for blood and oxygen. The heart then compensates by enlarging, developing more muscle mass, and pumping faster. The body tries to compensate in other ways too. The blood vessels narrow to keep blood pressure up, trying to make up for the heart's loss of power. The body diverts blood away from less important tissues and organs to maintain flow to the heart and the brain. Eventually, the body's compensation does not solve the issue, and the individual starts to experience signs and symptoms of CHF. These symptoms include shortness of breath, fatigue, edema, tachycardia, chest pain, weight gain, water retention, and loss of appetite. The family description of this case study included a 93-year-old independent female with a past medical history of hypertension, carotid stenosis, anxiety, a right hip replacement, type 2 diabetes, AFib, and a history of falls at home. She's been newly diagnosed with congestive heart failure and has early signs of dementia. She does live independently in a 2-story house. Her husband passed away about 10 years ago. She has 4 adult children, all living in town, and has 12 adult grandchildren, about half living in town. The family theory is a practice theory with a focus on health while involving family dynamics. The individual has affected the family due to the family's concerns of safety and medical compliance in the home while the patient is still living alone at the ripe old age of 93. The individual does not want to lose her independence by leaving her home. However, the family wants to explore options of assisted living to ensure her safety. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. This family was an educated, well-kept family who understood the individual's health issues, but did not understand her wishes to stay in her own home. A lot of education was needed for this family to understand the individual's wants and needs. Resources were reached out to in order to help the family understand that it was possible for her to continue to live independently. Some literacy issues with the individual was her age, cognition, anxiety, and lack of computer skills. Community resources. Erie does offer many home services for individuals along with a few heart failure clinics. The following resources were used for this family. The medical heart failure clinic was used. This clinic's goal is to help minimize the symptoms of CHF and reduce the number of hospitalizations due to CHF. The clinic provides medication evaluation and alterations, along with ordering necessary blood work and other tests, and scheduling follow-up appointments and home communication. Regional home health care and hospice services are available to clients, and these services include skilled nursing, therapy for physical therapy, speech therapy, and occupational therapy, along with hospice and personal care. One unique service offered is something called a medical social worker, who is assigned to find community support services for the client specific to their diagnosis. And finally, Bright Star Care, home health care services for patients with dementia and Alzheimer's. This is a specific service for those suffering with dementia. Services are provided in the home for patients and families with dementia and Alzheimer's. In-home inspections are provided to identify hidden hazards in the home and making recommendations for enhanced safety measures. was able to conduct an interview with one of the regional home health and hospice nurses, Ashley. She's been a nurse with this agency for about 3 years. She was able to give me a lot more insight in their services that were not displayed on their website. She's been employed with this agency for about 3 years. She's a primary skilled nurse for the patient's assignments that she has in a specific territory. According to Ashley, her office has services for everyone. She states that the services begin from discharge of a hospital admission or a doctor's office referral. Some patients are directed to their services by their primary care physician if he or she feels that further education and/or an overall health maintenance concern is present. The client never has to leave their home, however, they do need a means of communication, and that includes a working telephone line. Ashley does state this is a challenge for some people. If there are issues that the client has, such as a need for community resources, she states that she is able to simply refer to the medical social worker these concerns, and that person is assigned to find the resources that the client needs. Resources can include counseling agencies, food programs, supplies and equipment, interpreters, free services, and government-funded services, to name a few. She states it all depends on the client's needs. She also states that they can provide in-home safety inspections to identify hidden safety hazards and help to provide safety features in the home. This is what sparked the interest to me and the family because safety was a key issue for my client. Buchanan also states that if they are also able to monitor the patient's medication administrations, and this also was a huge concern for my family. Heart diseases is the leading cause of death in the United States. The goal for cardiovascular disease in 2020 is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attacks and stroke, early identification and treatment of heart attacks and strokes, and prevention of repeat cardiovascular events. In 2013, Alzheimer's disease was the 6th leading cause of death for all ages. The goal for dementia population in 2020 is to reduce the morbidity and costs associated with and maintain or enhance the quality of life for persons with dementia, including Alzheimer's disease. Diagnosis of dementia is key to effective treatment and care. Political and ethical issues related to this population. Ethical issues include respect for autonomy, end-of-life care, modern medicine, morbidity versus mortality, and palliative care. The biggest political issues for this population are costs of health care. This includes costs of insurance, Medicare, doctor's visits, skilled facilities, medications, and copays. Nursing knowledge and skill. Education. Education was a huge issue and intervention in this case study. For this individual in particular, the goal was safety at home and managing her symptoms of CHF. No extraordinary measures were decided by this family. So as long as the client was safe and able to continue her ADLs, the family was happy. However, in order to manage her symptoms and maintain safety in the home, a lot of education was needed. Signs and symptoms of CHF were reiterated to the family multiple times. Medication compliance using the teach-back method was done. In-home safety assessment was done to remove any hazards. A family plan was developed to ensure someone was in the house with the client most of the day to help with ADLs. The family also developed a meal plan in order for the client to have 3 meals a day and not have to use the oven. Other nursing knowledge and skills needed are active listening to the patients and families to understand exactly what they want, because not every family and patient has the same goals. Involve the patient in all aspects of care. Be a patient advocate. Monitor for signs and symptoms of CHF and prevention. This population is a vulnerable population. They have a high risk of elder abuse, decreased cognition, high risk for medication errors, high risk for safety issues, including falls at home, and safety issues with medical noncompliance, or issues with medication administration. Advanced practice nursing roles. Advanced practice nurses play a vital role in the future of healthcare. They serve as a primary care provider for many of the elderly patients. They educate on prevention of CHF symptoms. They improve overall cardiovascular health and quality of life. They're able to monitor medication and patient compliance. They're able to screen for safety issues in the home, along with involve family in all aspects of care and be the patient advocate. In conclusion, medication compliance, medical compliance, is vital in any new chronic disease diagnosis. Safety is a primary intervention in the elderly at home. Family needs to be involved in all aspects of care. Community resources provide optimal care for clients in their home. Nurses in advanced nursing roles need to be a strong patient advocate. Elderly, no matter what their diagnosis, are a vulnerable population. Ethical and political issues need to be addressed, and increased funding should be provided for the elderly with chronic diseases in order to provide optimal care and ensure medical compliance.